Right. Hi, my name is Grace Dimmick, and this is my final presentation for CPSE 203. So, the school I decided to go to was the Rocky Mountain Middle School up in Heber. And so I did both mild and moderate and severe. So, what I took away from mild and moderate was I really loved how many kids came into the classroom to that needed help to be worked with. It had like 4 times, 5 times as many kids with IEPs, with, like, learning disabilities or, different struggles like high functioning autism, different things. But a challenge that I foresaw and kind of experienced was having to be on top of all the kids' assignments and know the curriculum. You have to be aware of the kids' assignment, how to do it, how to help them, and that's just a lot of curriculum that you need to know. And so that seemed challenging to me from that category. And then in the severe classroom, I loved how they had their own classroom. They called it a learning lab, and it was way more hands-on. A lot of the kids stayed there the majority of the day, and I in the future want to work with early intervention children or those who receive ABA therapy. And so for this reason, I decided to choose severe for my emphasis. So, um, one of the students that I met is named Rose, and so she was about 13 years old, so like seventh or eighth grade. I wasn't sure exactly what her diagnosis was, but my best guess is autism. Um, Pretty low functioning autism just because of the communication barrier. And she had a hard time with fine motor movement. Her muscles seemed stiff and slow, is how I describe it. Rose, she has a para with her all the time, and so when she leaves the sped classroom, she goes to like the extracurriculars like art or adaptive PE. Otherwise, she receives most of her education in a severe special ed classroom. So these are some things that I've learned in the class or um, while at Rocky Mountain Middle School that I would apply to Rose. So the first one is the educational approach. So I'd focus on functional life skills based curriculum such as self care, communication, and basic academics. While I was there, she met with an occupational therapist and they worked on self care, like hygiene and grooming. Um, so that was really interesting to see. And then accommodations wise, I'd say we'd use adaptive equipment and technology to support her fine motor and communication needs, maybe a tablet or something. She can say a few words like stop, uh, hi, stuff like that, like just one words. But it's sometimes really hard to understand, like what she's trying to say. Just sounds more like grunty. For number three, her IEP goals, I would prioritize functional communication, such as using gestures, signs, or communication device to express needs and preferences. Like I said before, focus on feeding, dressing, personal hygiene, just to help her be independent, and then we can do that through occupational or physical therapy. All right, so for a transition plan, I think it's very important that we identify those post-school goals in employment, independent living, community participation, just see how much she can like live and do things on her own. Especially developing functional life skills like money management, transportation, self-care. The school did a school store where they earned money throughout the week and they were able to budget and figure out if they wanted to buy something at the end of the week. And so she was always able to buy things. She loved Talkies, loved buying Talkies. Um, Also coordinate with adult service providers for a seamless transition of supports, because she's definitely going to need support throughout her life. For assessment, um, there's formal assessment and then there's informal, just based on needs and learning styles. And then those assistive technologies to give her those accommodations. For number 6, integration. Peer mentoring and best buddies to foster friendships. I did best buddies in high school, and that was really amazing to connect with those kids. Collaborative teaching approaches to implement accommodations and extracurricular activities are really important in that inclusion and integration factor. All right, thank you.